Hello, I'm Dr. Vijay Bharat. I'm an allergist and immunologist practicing in Pune since last 20 years in Sai Allergy Hospital. So today we will discuss about the increasing problem of acute anaphylaxis or severe allergy reactions. Daily I am getting 8 to 10 patients. Out of that, at least one patient has a very severe skin allergies like urticaria hives or angioedema, swelling somewhere in the eyes or lips or the genitals, or out of 50 patients, one patient with a anaphylaxis like sudden breathlessness, choking or unable to breathe, and they are rushed to the hospital and it has to be managed. Why it is increasing? Because there is a epigenetics. So even the parents, if one of them have some or the other allergy, including rhinitis, asthma, food allergies, GI problems like GERD, stomach aches, or irritable bowel syndromes, or somebody has a sinusitis, migraine, ear problems. So these can be the signs in any of the parents, and the next generation, the severity, the duration, and the persistence is increasing. So these anaphylaxis patients, like example, one 15 years old female had been recently few days back to me, and last 6 months she was having, somewhere she was feeling like biting something, having urticaria, and suddenly breathlessness, and she had anaphylaxis. She used to give her adrenaline hydrocortisone UL was given, and she was revived. Again she was having every 15-20 days. When I examined her, she had a cough cold since childhood, after weather change and all, when nebulization or sometimes inhaler or some injection steroids was given, she was relieved immediately. Now she presented first time in her life with anaphylaxis after 51 years of it. Even her mother had asthma. Another 8 years old child from Latur, she was having some farsan like chuda or something, and she had anaphylaxis. When we tested, it was a Bengal gram or besan allergy. But along with that, she used to have sometimes weather change or ice cream or cold drinks. She used to have a cough cold. In between, she was having asthma. She was given inhalers. Sometimes she had some watering or itching of the eyes, or some in the childhood she had a GERD and food allergies that way. These are 10 years female child from Aurangabad. She was having some churma at house, and it was consisting of some nuts and all. When we tested, it was a cashew nut, kaju allergy, and she had a significant anaphylaxis. The mother had seen something in the movie, like how anaphylaxis presents, so she was knowing. So she rushed her to the hospital and she was saved. Even the pediatrician said, if you would have been late by 5 minutes, it would have been a disastrous. So this child, when we examined, she had a significant terminate posterior pharyngeal changes, and now she had an anaphylaxis. Even this 17 years female, she was given a vaccine and she had anaphylaxis. But when I took a history, in her childhood she used to have some atopic dermatitis and she had protuberance of the mandible, her teeth were in the front, and she was given a process. This child was admitted in the ICU with a peanut anaphylaxis, and the peanuts were contaminated with the dust mites because the peanut chutney was given. This young boy had a significant angioedema and was rushed to me from Bharati Engineering College. And when I examined, he had a significant changes in the nose and turbidates. This is a 15 months old child from one of the hospital in Aun was referred to me. After the MMR vaccine, the child had anaphylaxis. But that day, the child had played in a sofa, old sofa, and he was given moong dal, then milk and rice. So he had a sensitivity with multiple diseases. Dust mites was the more significant, and the vaccine MMR has a lactalbumin, which has a cross reactive to the egg protein. So he was sensitive to the egg protein also. This was a 23 years old male who was getting a root canal and he had anaphylaxis with the metronidazole because they were filling the with ciprofloxacin metronidazole that day. So always you have to be prepared for the anaphylaxis because it happens sometimes in one patient in a lifetime, but it gives a lot of stress to us, even it is a life-threatening disease. So we have to identify the early changes in a child with a colicky spasms or GARD or atopic dermatitis or eczema or repeated cold, cough, or children with the protuberance with brasses, open mouth breathing, tonsillar adenoids problems, or snoring. Even the adults with diabetic nasal septum, sinusitis, migraine, or skin allergies or ocular allergies. Even the children's 95% which have a rhinitis or cold can have a hidden ocular allergy like watering, rubbing of eyes or ear itching. That can be the signs of allergy. And these people are a high risk for severe reactions later on. So with the skin allergies or repeated secondary fungal infections also, or asthma. Now it's a World COPD week. So lot of allergy, asthma, COPD overlap syndrome is there. We have to identify that. So you can see this child, how he grows. Like we have traditionally, we use a besan or masoor dal and all for the massage. Then the dendritic cells, they get stimulated and gradually the Th2 cells into the body increase, and then the patient will have a hypersensitivity response some or the other day. And it always, the sensitivity because of the common foods whatever we are giving, or the common dust mites or pigeon feathers, droppings or insects, the patient is exposed to that, one fine day he overreacts. So the Ig into the body's specific allergen specific Igs are getting stimulated, they stimulate the mast cells, and then the inflammation into that local part happens, and that part will have a severe reaction. So ANA means without, while I say protection. So if you don't protect the child from that substance or like pharmacological drugs or stinging insects, foods, latex-like material, or some of the even aerosols. So which are the signs? Typically the child can have a itching in the palms or soles or in the head, or twitching or itching at the palates. Then he can have a flushing, then hives or swelling or angioedema in any part of the body. Even the eyes, the itching, watering can be there, redness or swelling over here or at the prepuce or penis. Like a lot of as a pediatrician also, I get a lot of parents, they say the child has been bitten by some ant or something. So ant doesn't go and bite over there, it is a reaction or somewhere the allergy has started. It is not the ant bite actually. So it is an allergy somewhere else. Even the child can have a significant sneezing, runny nose, nasal congestion or headache or giddiness, swelling of the tongue or feeling something heaviness over there. Metallic test, it can be one of sign of severe allergy. Then the lungs, the child can have, or the adult can have breathing difficulty, coughing, chest tightness, wheezing, or the stridor can be there. Then choke up or voice change can be there. So these signs also can mislead us as a heart attack also, some of the patients. So you have to be very, very careful identifying these. Even like as I said, weakness, dizziness, fainting, tachypnea or palpitations, hypotension or low blood pressure, they can be the signs of it. Then stomach like nausea, vomiting, cramps or indigestion, diarrhea can be there. Then nervous system like anxiety, confusion or sense of impending doom or hallucinations can be there. So clinically all these signs we have to identify. It is always sudden or sometimes it is a late phase reaction. Even after that stimulation from some vaccine or something, after 4 hours also the patient can have a problem. So as the first aid, we have to always keep the child into the patient into a pendulum position, lift the limbs, increase the flow to the cerebral blood flow. Airway breathing circulation, it is always there, but the drug of choice is always adrenaline. So it has to be given intramuscular. There are misconceptions of subcutaneous. Now the guidelines have changed. We have to always give an intramuscular. Always be prepared. Whenever you enter your clinic or hospital, keep 0.3 ml or 0.5 ml of adrenaline ready into your syringes with a proper needle and cap, so that anybody develops it. It is very important because once in a lifetime it will save the patient's life also and your stress also. Then the blood pressure and other things has to be managed. So we know like airway within circulation, ABC of any severe patients. And after the adrenaline, then you have to always give a hydrocot and followed by dexamethasone, because immediate and late phase biphasic reaction is there, and some patients can have a lateral reaction also. And after once we manage with localized like Avil or some cetirizine and all, this itching if it is there, it can be reduced. But later on, the patient has to be referred to the proper allergy expert, because further anaphylaxis episodes and the progress of the disease or severe reactions from the body has to be stopped with the proper selected allergen testing after the detailed history, the exposure of the patient or gut inflammation which is caused by the foods, or dust mites exposure or effusion either or dropping water. See, sensitization and the sensitivity reaction is different. Like I always give an example, suppose the rains are there, they will have a leakage from the wall, but the primary leakage is always from somewhere, some basins or bathrooms or all. The same way, the gut inflammation or the airborne allergens or the drugs, we have to identify, we have to test with the skin prick test. Gold standard is the modified painless, bloodless skin prick test than the advertised blood allergy test. Like there are a lot of advertises in the newspaper, they are misleading. The accuracy is much better with the modified skin prick selected allergens. So once we identify that, we ask you to avoid some of the allergens or give a immunotherapy or desensitization or allergy vaccines. They are painless, bloodless now, very safe, and it has a long-term control for the allergy as well as prevention of the anaphylaxis.